Hey, what's going on? It's Dr. Mike T. Nelson here. I'm showing you some of the RPR stuff. So, reflexive performance reset, which is based on the work of some deactivated stuff from Doug Heel. So what this is looking at different points on your own body to try to get a little bit better muscular function. So one of the questions was, what do you do for stuff with someone who has kind of a left knee that has an issue? Obviously, this is not intended to be physical therapy or anything like that, so make sure you're cleared by your doctor, physical therapist, that type of thing first. But a lot of people just have kind of general achy knees, and if you have it more on one side or the other, you've probably got something going on that side, or even all the way into the opposite side of your upper body. So a couple of points that'll really help. If we look at what is a priority in terms of human movement and just survival, the top two things are going to be, number one is breathing, number two is hip flexion and hip extension. So hip flexion, hip extension is basically just your ability to walk or to do gait. So some of the spots that you would want to try. So for breathing, a lot of people tend to pull their shoulders up here and use a lot of these accessory muscles and up into their neck for breathing. So one of the big spots for that, although it's not technically a breathing spot, is just to find the top part of your collarbone, come down about 2 inches. And what helps is to make a fist just like this, put your thumb over the other end. So that way when you're pushing on tissue, your thumb doesn't get very tired. If you keep doing this all day, your thumb's gonna kind of wear out. So you're finding the collarbone, basically your clavicle, come down about 2 inches in the front, so you're like right kind of on the top middle part of the pectoralis. And then I'm just kind of pushing around, kind of going around in a circle there. I'm actually trying to get pressure on what's called the fascial layer. And a lot of times you'll find a spot, like on me, woohoo, right there in the middle, I can find is pretty sensitive. So I'm just trying to get this tissue to move around a little bit better. Total time just depends on what you find. At least 30, maybe 60 seconds, sometimes a little bit longer. So that side, obviously you can do the same thing with the other hand on the opposite side. I'm showing you these in a seated position, but usually when you're starting, laying down is going to be easier, so you can get a little bit more pressure there. Other parts to look at is, imagine like this is an upside down Y. So right down the middle of the sternum, which is right in the middle. So you're doing the exact same thing here. And I'm just feeling for what areas feel kind of tight. Just trying to get some of that area to move. A lot of times you'll find little restrictions. And if you go a little bit off center, it's like right on the border of where the pectoralis would be. A lot of times you find some kind of, just feels very crunchy. A lot of times you'll find that it's very sensitive also in those areas. So just going down the middle of the sternum, and then the bottom part of the ribs going across. So same thing, usually with this area it's more of an up and down type motion, and you can feel it kind of jump over the ribs there a little bit. And especially in this position here, I'm right on the border bottom of the rib, and I'm actually going up into the bottom part of the pectoralis muscle there, where it kind of attaches. So I go all the way around to the side there, here, all the way around to the side, same thing. Obviously I'm just showing these a little bit faster. The other part is the psoas. So right in the belly button here, go right off into the middle there. So if you find the side of your hip, come straight up, your belly button, and then right about in the middle there. A lot of times you'll find some tissue that's kind of stuck. And again, I'm just trying to make a nice circular pattern, trying to get that to move. In a perfect world, a lot of these tissues actually should not be hypersensitive. But a lot of times if you've got some stuff going on there, they'll actually be quite sensitive. The other part is the hip. So if you find the top part of the hip, what's called the ASIS, so where your hip comes here and then basically starts to come down. So go around that area. They usually say like the size of a large silver dollar. So I'm just kind of going around that area here on both sides. And I can even follow, if you look on the side, the border of my pelvis here, follow this border kind of all the way around on the side and all the way around in the front. So if you've got some left knee issues going on, usually this side is going to be a little bit more than that side, but probably going to do both sides too. Now, last 2 points just to check, and again, there could be others too. So if you find your quad, your rectus femoris goes right up the middle, attaches to your hip, and then goes over the knee. The knee floats in the rectus femoris, which is part of your quadriceps muscle. So it's called the sesamoid bone. And if you just kind of palpate through here, kind of poke around, and right as you come up, usually right about in the middle of your femur, your upper leg, and then if you take this side from the inside to the top, so go right about in the middle of both those spots. And again, you'll find, like on myself, where that's really, really tight. And then I would just come along that whole border. So here's the top part of my leg, and I'm just right along that border, right along the midline, right in the middle. So this is right on what's called the VMO. So if you flex your muscle here, this little muscle that sits on that outside part. So you're going right along the border there, trying to get that to slide up and down. So those are the main points that I would look at, starting with upper chest, so inverted Y, right along the rib cage, the sternum, kind of the psoas points, into the leg, left side, up in the hip, down here, and then over onto the knee. So you're going right along this midline here. And then the last point to do, which is weird as it sounds, it's actually for your glute max. So if you can see, if you find the back part behind your head, so kind of right where your skull comes down and goes back across. So you can find that area here, and you're just trying to get that tissue that's right behind your ears just to kind of move around and slide as best you can. So those areas I would start with, prioritizing breathing, and then looking at hip flexion and extension, and making sure all the muscles there in the quad are moving well. Time, 5, 10, maybe 15, 20 minutes, just depending on what you find. And then follow that up by just doing some nice belly breathing for at least 15 to 20 breaths, or even a little bit longer. So when you're inhaling, you're trying to get your stomach to actually come out a little bit more. These should be relatively quiet, and you'll still have some movement through there, but most of the breathing should be done through that area. So check that out and let me know. Thank you.